Right now, without moving from wherever you are, I want you to look at your hands. Not a quick glance, a real unhurried look. Spread your fingers out and hold them up to the light for just a moment. Because what I'm about to walk you through in the next several minutes is something that most people go their entire lives never learning. And it is something that could genuinely matter to your health in ways you have not been told. Your fingernails have been quietly working as a live monitoring system for your cardiovascular health your entire life. Every single day, while you were going about your routine, they were recording what was happening deep inside your body, inside your blood vessels, inside your heart, inside the tiniest capillaries that most medical instruments can't even easily reach. The problem isn't that this information doesn't exist. The problem is that nobody has ever sat down and explained it to you in a way that actually makes sense. That ends right now. I want to be clear about something before we go any further. Everything I'm going to share with you is grounded in real clinical medicine and genuine cardiovascular research. These aren't folk remedies or wellness trends. These are signs that cardiologists and trained clinicians observe and act on every single day. The reason most people haven't heard about them isn't because they're obscure or unreliable. It's because a 15-minute appointment is barely enough time to run through the basics, and nail examination almost never makes the priority list unless something is dramatically, unmistakably wrong. But here's the thing that troubles me most about that reality. Many of the cardiovascular conditions most dangerous to people over 60, heart failure, coronary artery disease, silent heart attacks, dangerous arrhythmias, develop slowly and quietly over months or years before anything dramatic happens. By the time something obvious shows up, the opportunity for early, effective intervention has often already passed. Your nails, in many cases, have been showing the story much, much earlier. So let's talk about why that's true, and then I'm going to take you through each of the specific signs to look for, one by one. Beneath the base of each of your fingernails sits a structure called the nail matrix. This is where new nail cells are continuously produced, where your nail literally grows from. The cells in the nail matrix are in constant, direct contact with your bloodstream. They're nourished by some of the smallest blood vessels in your entire body, microscopic capillaries that thread beneath the nail bed in a dense, intricate network. Because those vessels are so extraordinarily fine, so narrow and so sensitive, they are among the very first structures in your body to show strain when your cardiovascular system begins to struggle. Think of them as a pressure gauge. When something changes upstream, the gauge registers it. And because your nails are on the outside of your body, you can actually see what that gauge is doing if you know what to look for. After the age of 60, this matters more than it did in your 30s or 40s. When you're younger, your heart and vascular system have significant reserve capacity. They can quietly compensate for early dysfunction for years, sometimes decades, without anything visible surfacing. As you get older, those reserves become thinner. Early warning signals begin appearing sooner, and your nails are very often among the first places those signals show up. That is not a reason for alarm. It is actually a reason for optimism, because early signals, if recognized, create the opportunity for early action. Let me walk you through what to look for, starting with one of the most significant and least known signs. The first is called Terry's nails, named after the physician who first formally described it in clinical literature. The appearance is distinctive, and once you know it, you will recognize it immediately. The nail takes on an unusual whitish or frosted glass appearance across its entire surface, almost opaque rather than the normal healthy translucency. But the defining feature, the detail that makes Terry's nails clinically specific rather than just generic paleness, is a narrow band of pink or reddish color that appears at the very tip of the nail, just a few millimeters wide, running across the far edge. Look for that strip specifically. If your nails are pale overall, but that pinkish band is present at the tip, that is the hallmark of Terry's nails, and it is a finding that warrants medical attention. Research published in Cardiovascular Medicine has identified Terry's nails as significantly associated with coronary artery disease, heart failure, and diabetes. One study found that individuals with Terry's nails had an odds ratio of over 6 for coronary artery disease compared to those without them. To give that number context, that's a relationship as strong as the link between smoking and certain cancers. It is not a minor statistical footnote. It is a major signal. Every condition associated with Terry's nails shares one characteristic. It develops gradually and silently over a long period before anything obvious happens. A man I'll call Robert came to see me at 71. He wasn't in visible distress. He felt reasonably well, though he had been more tired than usual, something he had naturally attributed to getting older. During his examination, I noticed his nails were unusually pale with that characteristic reddish strip at the tip. I asked careful questions, ordered an echocardiogram, and the result revealed early-stage heart failure that had been developing quietly for close to 2 years without any symptoms he had consciously registered as abnormal. Robert is doing well today. He got the right diagnosis at the right time, and it was his nails that opened that conversation. The second sign is called Lindsay's nails, sometimes referred to in clinical practice as half and half nails, and the name describes the appearance almost perfectly. The nail is divided into two clearly visible zones. The half closest to your cuticle appears white or very pale. The half closest to the tip is a distinctly brownish-red color. The dividing line between these two zones is usually sharp, not a gradual fade, but a clear boundary. Lindsay's nails have been associated in clinical research with heart failure and liver cirrhosis. Like Terry's nails, they tend to appear after the body has been under sustained circulatory stress for an extended period of time. Both of these nail color disorders, Terry's and Lindsay's, reflect the same underlying problem. Something is compromising blood flow to the smallest tissues in your body, and the nail bed is registering that change in its pigmentation. Both signs are visible in ordinary daylight. No equipment needed. Hold your hands up to natural light right now, while these descriptions are still fresh, and look carefully at each nail. The overall color, any unusual paleness, any two-tone division, and whether there's a reddish band at the tip. You can check for both Terry's nails and Lindsay's nails in under 30 seconds. The third sign is called Muirca's lines, and these are different from nail color changes. Instead of affecting the overall tint of the nail, Muirca's lines appear as multiple horizontal white bands running across the nail, parallelly to the crescent-shaped pale area at the base called the lunula. These lines can show up on several fingers at once, and there's an important detail that distinguishes them from other types of nail ridging. You can see them clearly, but when you run your fingertip across them, you cannot feel them. They're entirely flat. That invisibility to touch is one of the key clinical details that helps identify them correctly. What makes Muirca's lines particularly significant is the research behind them. A study examining the relationship between nail findings in cardiovascular disease found that these lines were a statistically significant predictor of heart failure, with an odds ratio approaching 6. The underlying mechanism is that these bands reflect low albumin levels in the blood, a marker of the body being under prolonged nutritional and circulatory stress. When the heart is struggling to circulate blood efficiently, the consequences ripple outward in ways that show up in the fine details of the body's most peripheral tissues, including your nails. A woman I'll call Catherine came to see me at 68. She was active, not overweight, and genuinely felt well. She mentioned almost as a side note that she had noticed some horizontal lines appearing on her nails over the past few months and had assumed it was probably just aging. I looked carefully and recognized Muirca's lines across several fingers. A cardiovascular workup revealed early heart failure, entirely manageable at that stage. Caught precisely because she mentioned something she had almost dismissed. Her body had been quietly raising its hand for months. The lines were the signal. The fourth sign tells a very different story from the first three. Where the previous signs reflect chronic, slowly developing conditions, this one appears in response to a specific event. It is called Bow's lines, horizontal grooves or depressions that you can actually feel running across the nail plate, not just see. Here's what causes them. When the body undergoes a significant physiological shock, a heart attack, major surgery, a severe infection, a serious medical crisis of almost any kind, the nail matrix briefly stops producing new nail tissue. It effectively pauses. When production resumes, the pause leaves behind a physical groove. Over time, as the nail continues to grow, that groove moves toward the tip, and its position along the nail can help estimate roughly when the event occurred. A groove halfway down the E-nail on a nail that grows about 3 millimeters per month suggests the event happened roughly 3 to 4 months ago. What makes Bow's lines clinically important is that they can reveal a past cardiac event the person themselves never fully recognized. Silent heart attacks are considerably more common than most people realize, particularly in older adults, where the classic dramatic symptoms, crushing chest pain, left arm numbness, shortness of breath, are frequently absent or mild enough to be attributed to something else. A man I'll call Harold came in for something entirely unrelated. I noticed a clear horizontal groove running across nearly all of his fingernails. When I asked about it, he reflected for a moment and recalled being seriously unwell about 4 months earlier with what he had assumed was an unusually severe flu that laid him out for nearly 2 weeks. Testing revealed he had experienced a silent heart attack during that illness. His Bow's lines had recorded the event faithfully. His memory of the symptoms had not. The fifth sign requires you to look not at the surface of the nail, but beneath it. These are called splinter hemorrhages, and they look almost exactly as the name suggests. Tiny, dark, thread-like lines running vertically underneath the nail, resembling small, dark splinters trapped beneath the surface. They are actually small collections of blood that have leaked from the capillaries in the nail bed. One splinter hemorrhage on a nail that received a knock or a pinch recently is nothing to be concerned about. Trauma explains it cleanly, but multiple unexplained splinter hemorrhages appearing across several different fingers with no history of trauma is a clinically significant finding that warrants prompt attention. In medical training, Unexplained splinter hemorrhages across multiple nails are classically associated with a condition called infective endocarditis, an infection of the inner lining of the heart's chambers and valves. This develops when bacteria enter the bloodstream, sometimes through dental procedures, sometimes through other routes, and attach to already damaged heart tissue. The infection generates tiny clots that break off and travel through the bloodstream to distant blood vessels, including the minute ones beneath your nail bed. Infective endocarditis is serious and requires urgent treatment, but it is also treatable when caught in time. The patient I'll call Francis noticed dark lines under several nails and mentioned them almost as an afterthought during an appointment focused on something else entirely. She told me afterward that she had almost not brought it up because she assumed it was probably cosmetic. She was diagnosed with a heart valve infection, caught in time to treat effectively. That afterthought she nearly swallowed may well have saved her life. The sixth and final sign is one that people almost always overlook because they've never been told what it means. It involves a small pale crescent at the base of your nails called the lunula. Most people think of it as simply a cosmetic feature, a part of the nail's appearance that varies slightly from person to person. In reality, the lunula is the visible portion of the nail matrix itself, the active zone where new nail cells are being created, and its color and size carry meaningful information about your cardiovascular health. A lunula that has taken on a reddish tint has been significantly associated in research with valvular heart disease and congestive heart failure. A bluish or purplish lunula suggests problems with oxygen delivery in the circulation, similar to the cyanosis that clinicians look for in more advanced cardiovascular disease. And a lunula that has faded to almost nothing or become very pale is often a sign of anemia, which matters cardiovascularly because an anemic heart must work significantly harder to compensate for reduced oxygen-carrying capacity in the blood. Sustained anemia places real strain on the heart over time. What makes this sign particularly easy to miss is that it changes gradually. A woman I'll call Dorothy was 74 when her daughter, who happened to be a nurse, visited for a family occasion and noticed that the small crescent shapes at the base of Dorothy's nails had nearly disappeared. Dorothy herself hadn't noticed because she had been looking at those same hands every single day, and the change had been slow enough that she had simply adjusted to the new normal without consciously registering that anything had shifted. Her daughter encouraged her to raise it at her next appointment. A complete blood count and cardiovascular workup revealed significant anemia and early cardiovascular strain, both caught and treated before anything serious developed. The lunula had been quietly fading for months. Now I want to teach you a test you can perform on yourself right now using nothing but your hands. It is called the capillary refill test, and it directly measures how quickly your smallest blood vessels respond to pressure, which is a direct proxy for how efficiently your microvascular circulation is functioning. Here's how to do it. Hold one hand at the level of your heart. Use the thumb of your opposite hand to press firmly on one of your fingernails for about 2 seconds. You'll see the nail bed blanch, go pale, as the blood is pushed out from beneath it. Then release the pressure and begin counting quietly. Watch for the pink color to return. In a healthy adult with good circulation, the color returns in under 2 seconds, often in 1. If it takes 3 seconds or longer, and you get the same slow result when you test 3 or 4 different fingers on both hands. That is a meaningful indication that your microvascular circulation is sluggish. Research has linked persistent slow capillary refill in older adults to reduced cardiac output, undiagnosed atrial fibrillation, and elevated stroke risk. A man I'll call William tried this test one evening out of curiosity. He counted nearly 5 seconds before the color returned to his index finger. He tested 3 more fingers on the same hand, then 3 on the other. The same slow result every time. He called the next morning and described exactly what he had observed. A full workup revealed undiagnosed atrial fibrillation, one of the most common and dangerous causes of stroke in adults over 60. He had no symptoms that had alerted him. None. Just a home test with his own 2 hands and the knowledge of what he was looking for. So here is what I want you to do, starting today. Take both hands to a window in good natural daylight, not the filtered light through a screen, not dim indoor lighting, but real daylight. Look at each nail one at a time, and work through what you've just learned. Check the overall color of each nail bed for unusual paleness, or any blue or purple tones. Look at the tip of each nail carefully for that characteristic reddish band that signals Terry's nails. Look for the sharp 2-tone division, white nearest the cuticle, brownish red at the tip, that signals Lindsay's nails. Scan across each nail for horizontal white bands that you can see but cannot feel. Mirka's lines. Check for any deep horizontal grooves that you can feel. When you run a fingertip across the nail, Beau's lines. Look beneath the nail surface for any tiny dark vertical lines that appeared without any trauma. And examine the base of each nail for the lunula. Is it still there? What color is it? Has it been shrinking? Then do the capillary refill test on at least 3 fingers and count the seconds, honestly. Write down what you find. Photograph your hands in natural light today. Not because something is necessarily wrong, but because these changes are slow and gradual. And human memory is genuinely unreliable across months. A photograph gives you something concrete and honest to compare against 6 months from now. It removes the fog of gradual adjustment that Dorothy's story illustrates so clearly. If you notice one of these signs, bring it up at your next routine appointment. Show your doctor what you observed. If you notice 2 or more signs together, don't wait for your annual checkup. Call your doctor's office this week, describe specifically what you found, and ask whether you should be evaluated sooner. You are not diagnosing yourself. You're giving your doctor specific, informed, detailed information that opens the right conversation at the right time. That distinction matters enormously. The role of this knowledge isn't to turn you into your own cardiologist. It's to make you a far better witness to your own body. It's to give you a specific, grounded reason to speak up, rather than assume that something you've noticed is probably nothing. It's to close the gap between what is visible on your body and what gets acted on in a clinical setting. Because here's the truth about the people in those stories I shared with you. Robert, Catherine, Harold, Francis, Dorothy, William, every one of them had signs that their bodies had been showing for weeks or months before anything was caught. In some cases, much longer. The information was there. The signals were present. What was missing was someone who had told them what to look for. Someone who had given them the specific vocabulary and the clinical context to recognize what their own body was already trying to communicate. Your nails have been at the end of your fingers every day of your life. They've been keeping a record, quietly and faithfully, of what your heart has been doing, how your blood has been moving, what your smallest blood vessels have been experiencing. The only thing that was absent was the key to reading that record. You now have that key. Use it. Check your hands today. Share this with someone you care about who is over 60 and not paying close attention to their health. You genuinely do not know whose life that conversation might change. And above all, notice, document, and speak up. That is the part most people never do. And it is, more often than most people realize, the part that makes all the difference